Your vision continues to inspire us towards brighter horizons of the future. I would now like to request our Honorable Chief Guest, Dr. Dilpreet Brar, to kindly come on the dais and share her thoughts on this colloquium.
Good morning, ladies and gentlemen. What a matter of great pride to be part of this event today. Of course, I still can't get over being called the Honorable Chief Guest. This hasn't happened to me before. I was sitting and having a cup of tea with Mr. and Mrs. Parijat, and I realized that what you all are doing here at this point in time, since the last 5 years or so, is so much a needed thing in the industry today. Being part of management of a few hospitals and healthcare providers, we see that there's so much lack of true management talent. I mean, we get a lot of people who do their MBAs, even do MBAs from overseas, from the best of institutes and come, but how do we get them to understand healthcare, for example, is a very big challenge. The doctors need to understand the business, and the non-doctors need to understand the clinical side. And they learn it on the job. There's almost no one in the industry today who's really making the effort of teaching management specific to healthcare before they enter healthcare. Everybody learns on the job. I was a doctor, did clinical practice for many, many years, 15, 16 years, then went into management, learned almost everything on the job. I went for an executive MBA somewhere during the middle and just validated what I already knew, but nobody taught me before I went on to the job. And so that's not just painful, it takes time. It really, really takes a lot from the system, because the system then teaches the management professional what they need to know. So I think some of you students sitting here are indeed lucky to be part of an institute where you're being taught beforehand. So you know what you're getting into, and you're getting the knowledge before you really are thrown into the deep end of the pool, So congratulations for being here, and congratulations for setting up a place like this. I think it's really the need of the industry. And actually, if I was to tell you a few challenges of management in healthcare, I could go on, and probably this entire event could go on with just me sharing my experiences. We could talk about empathy, we could talk about integrity, we could talk about understanding, we could talk about treating the patient like a human being and not just a few reports like you said. The need is enormous, and I think you just can't put it together in a course. There's so much more to it. When I was coming here and I was thinking, what indeed is the biggest challenge that we are facing today? And there's something that we managed to make work in Fortis Memorial, that's the hospital I'm leading at the moment, which is multidisciplinary team care, getting few doctors together to sit around a table and to discuss one patient, and to let go of their egos and understand that patient as a patient, not as a statistic, not as a bunch of reports, has been a big challenge. But the bigger the challenge, the bigger the reward. And what you get out of it, when you are walking out of that room and you're coming out with an answer for that patient, which is a joint answer, because you have the diagnostic people sitting there, you've got clinical people from a few specialties who really have argued over that patient, because everybody knows everything, right? I mean, we doctors know everything. There's no question. Dr. Kakkar sitting here, far more senior than all of us know everything. Right? When we walk into that room to discuss a patient, we just know exactly what to do. But when we sit there and we discuss, we realize, no, we actually don't know anything. So the first thing is to get that ego aside, put the patient first, and then have a discussion. And I can share with you that a lot of very, very senior clinicians have then come back and said what a great experience it's been to work together as a team to get that patient well. Somebody who's a diagnostic challenge when he entered the hospital goes out treated, not just with a diagnosis, is an immense experience, and I tell you, a big management challenge. That's something which has to come from within. It's something you learn during training. It's something you learn about the industry while you are training. So there are lots of such challenges. Wish you all the best. I hope you come to our hospitals already trained and already knowing a lot. All the best, and thank you so much for arranging something like this. I think it will go a long way in helping us manage better.